Now, with this housekeeping done, we hand the floor over to Dr. Sood to begin today's deep dive.
Thank you so much, Janice. My name is Anubha Sood, and I direct the Total Care Program for Parkinson's disease here at the O'Donnell Brain Institute at UT Southwestern. So the Total Care Program, as some of you know, and a lot of you here are new as well, and we're delighted to have you, delivers educational resources, personalized care, and a supportive community to families that are navigating the Parkinson's disease journey. To participate in any of our events that are held virtually and also in person on campus here, please look up our webpage. I will post a link in the chat there for you. Also, we would like to hear your feedback about this event, want to hear if you have ideas for future events. So I will also post a link to a feedback form, and we would love to hear your feedback and also your suggestions for what we should do next with the Total Care Program in terms of events, whatever you think may be of support to you. With that, I am absolutely delighted to welcome Elizabeth Guerrero, who is the Community Education and Outreach Manager for the South Central chapter of the Parkinson's Foundation. And she's going to talk to us today about her incredible organization, Parkinson's Foundation, and Elizabeth in particular has been a very experienced, knowledgeable, and compassionate advisor for us as we have been, getting on this total care journey and getting this program started. So we're so grateful for her friendship and for, guiding us through this program. Thank you so much, Elizabeth, for all you do for our community. And now on to you.
Thank you. Thank you so much for that warm welcome. And it's been an absolute pleasure to be a part of the Total Care Program and, with UT Southwestern, just having the partnership that we have. Can y'all hear me okay? Yeah, anybody can hear me okay?
Good here.
I can hear you fine.
Okay, fabulous. All right, so I'm going to share my screen. And like Anuba said, I'm Community Education and Outreach Manager for South Central Chapter, and we're a national organization, but we're also broken down. We have national initiatives and research, and I'm going to explain all of that in our presentation. But we're also divided into chapters as well amongst the region, and this just helps us to be able to really focus on the community and have relationships with hospitals and support group leaders, and just really be in the know and kind of the boots on the ground in each community, because as you know, every city, every region is different, and so it's just good to have localized people. However, localized for South Central Chapter is Texas, Oklahoma, and Arkansas, and so it's quite a large territory for our tiny but mighty team. I'm going to share my screen. And and I forgot to say, I've been with the foundation for 3.5 years now. Coordinator, and then moving into a manager position a year ago. All right, make sure I'm sharing. Everything looks good. So I'll do a brief presentation. I believe this will take about 15-20 minutes. And then I just want to open the floor up for questions and share, more resources, especially on our website. And I'll go into that. I'll just move around. Taskbar. Okay. There we go. So I'm going to dive into explaining an overview of the foundation. So the Parkinson's Foundation is the nation's leading community for people living with Parkinson's those who love them, and those who are working to end the disease. With the largest presence in Parkinson's communities across the country and globe, we have everything you need to live better with Parkinson's today. Our mission is to make life better for people with PD by improving care and advancing research towards a cure. And everything we do, we build on the energy, experience, and passion of our global Parkinson's community. And I'll say that any steering committee that we have, new initiative, in each of those committees, initiatives, advisory councils, boards, we do that in partnership with the Parkinson's community. So we always have someone with Parkinson's, caregivers, always on each of those steering committees, boards, because the input from the community is crucial to ensure that we're doing what is needed for the community and what the community wants to know and learn about as well. So our vision is a world where no one has Parkinson's disease. And our mission is urgent, as you know. 1 million Americans are living with Parkinson's disease, and 90,000 more are diagnosed each year. And I'll say that was increased from 60,000. I'd say a year and a half ago, it was believed that 60,000 people were diagnosed each year. And then after a study was completed, it was raised up to 90,000 each year. So Parkinson's is the second most common neurodegenerative disease, and prevalence is expected to rise to 1.2 million over the next 20 years. It primarily impacts people who are 60 and older, and it's a huge economic burden. At the Parkinson's Foundation, we believe people with Parkinson's deserve both the promise of a cure for tomorrow and a better life today. While there is no cure yet, treatments and expert care can improve quality of life. So what we do, we bring together people with Parkinson's, caregivers, medical professionals, and researchers to support cutting-edge research that leads to breakthroughs in treatments and a cure, ensure every person with Parkinson's has access to the best care, empower you and your family with resources and emotional support as well. And for tomorrow, we focus on, like I said, advancing research toward a cure. So I'm going to dive into that. Since launch, the foundation has funded more than $449 million in groundbreaking research and care, fundamentally forming the way we diagnose and treat Parkinson's. Since 2010, the foundation has supported more than 670 scientists researching Parkinson's. Research has always been paramount. In 1969, a Parkinson's Foundation leader and PD expert published the first blind clinical trial of levodopa, proving the medication could relieve Parkinson's symptoms. We use the expertise of the Parkinson's community who help us identify needs and drive cutting-edge research on the issues they care about the most. And I'll say, one way we do that is through our PPAC. It's our Person with Parkinson's Advisory Council. And this is a group of 15 people nationwide who are either a person living with Parkinson's or a caregiver. And they are our steering committee. And we do everything in close concert with them on identifying needs and resources and education. In addition, we created the first research agenda to improve the care of women living with PD, addressing the long-standing gender disparities in Parkinson's research and care. Additionally, for investing in new treatments, our Parkinson's virtual biotech, this is a drug discovery and development arm that aims to deliver new treatments in years, not decades. Through our partnership with Parkinson's UK, we are providing targeted funding to develop new therapies and medications while increasing resources for research and development. And then I'll dive into PD generation, mapping the future of Parkinson's disease. This is a first-of-its-kind national initiative that provides genetic testing for clinically relevant PD-related genes and counseling for people with Parkinson's at no cost. And this is offered in English and in Spanish. PD generation aims to provide genetic counseling to, so it was the goal this past year was 15,000, and we actually, by the end of the year, we exceeded that to 20,000, thanks to a very generous grant that we received to really propel this research. And over the next 6 months, our goal is to have 6,000 more. And the overarching goal of PD generation is to leverage genetics as a powerful tool to help us uncover what is responsible for slowing or stopping the progression of Parkinson's. This knowledge will propel us towards optimizing Parkinson's treatments and advancing clinical trials. Currently, genetic tests are either not available or not affordable for people with PD, and unfortunately are not covered by health insurance or offered with genetic counseling. Therefore, most people with PD and their clinicians do not know if they carry the genetic mutations in important Parkinson's-related genes. PD generation addresses this unmet need and provides genetic testing at no cost to study participants through in-person sites and an at-home kit. You can enroll and learn more by parkinson.org PD generation. And I'll share the link to that as well if anybody's interested. What I appreciate the most is that we do the genetic counseling for every single participant, just to have a better understanding of your genetic makeup, and you know, the hope is one day to have tailored for each, you know, anybody who has a genetic link to Parkinson's, to have a tailored trajectory of care to optimize care. And so for today, we'll look at how we're improving care for everyone living with Parkinson's disease today. So the Foundation's mission is to ensure that people with Parkinson's and the ones caring for them and their care team have a common understanding, the same understanding of quality care. While everyone's experiences Parkinson's differently, and you've probably heard it, if you've met one person with Parkinson's, you've met one person with Parkinson's, everybody's journey is different and unique. So having access to a comprehensive care team will enable people with PD to better manage their symptoms and improve quality of life. Our global care network creates more opportunities for people with Parkinson's to access high quality care and more opportunities for health professionals to advance and share their knowledge. We have centers of excellence, which I'll talk some more about in the next slide, that are all located in the shaded regions on the map, as well as 9 countries abroad. And this network delivers care to over 200,000 people annually. So the Global Care Network consists of centers of excellence and comprehensive care centers. Both must demonstrate exemplary multidisciplinary care and community partners in Parkinson's care. Centers of excellence are medical centers with a specialized team that knows the latest Parkinson's medications, therapies, and research. They conduct PD research, and comprehensive care centers meet the same criteria as a center of excellence, but they do not host research. We will designate 15 new centers by 2027. Community partners in Parkinson's care are long-term care communities and home care agencies with staff trained in Parkinson's care. As part of our strategic plan, we are committed to continually expanding our global care network in order to increase accessibility to evidence-based PD care. And I'll dive into some of our educational resources now. And so living well with PD means getting the support that you need, from tools that help you work alongside your care team to resources that empower you with knowledge. The Parkinson's Foundation is your trusted ally for information that can help you navigate every stage of this disease. Our resources are designed to help guide you along all stages and symptoms of Parkinson's. You can explore our PD library at parkinson.org/library, and I'll share that in the chat whenever I wrap up. And you can, in the search button, what I really like about this is you can just type in key topics, or on the left, and I'll show you, it has an accordion of different symptoms, and then it will populate all of our resources available to you in our Parkinson's library. And so some examples are young onset, PD, mental health, and so all different various topics. You can also contact our helpline at 1-800-4PD-INFO or helpline@parkinson.org, and I'll share this all in the chat as well, and get your PD questions answered in English and in Spanish. The helpline is open on Monday through Friday from 8 a.m. to 6 p.m. Central Time. And our helpline staff can help you order free publications, make sure you have the information you need to live well and stay safe when receiving care. I'll share, like the slide said, the helpline takes 26,000 calls a year, and that's been a huge increase because 2 years ago it was 20,000, and so we've increased quite significantly of calls with our helpline. And I'll say that they are one of our best resources. Any question that you have under the moon, they've been asked just about everything, and they will help you navigate any questions that you may have and empower you with resources as well. So additionally, these are on top of the helpline, 2 of my favorite resources that we have, and we've revamped these from feedback from the Parkinson's community. We've made these 2 resources better. And so we have our newly diagnosed campaign. It's working to close the gap between PD diagnosis and the essential resources that can inspire and support people new to Parkinson's. The goal is to arm people who are newly diagnosed with the knowledge, tools, and resources they need as they begin their own personal journey with the disease. Many of the 90,000 people diagnosed each year with Parkinson's navigate the disease alone for years. People who engage with the Parkinson's Foundation early and often report better outcomes and better quality of life as well. Through our initiative, those newly diagnosed spouses and family members can learn, can learn more by calling our helpline, joining Parkinson's disease conversations, and accessing tailored resources at parkinson.org/newly diagnosed. And again, I'll show you all these websites, the web pages on our website as well. And then additionally, if you're familiar with the foundation, you may have heard about the Aware and Care Kit. And so we have evolved that into the Hospital Safety Guide. And we've turned it into, instead of a kit, into a booklet, but it has perforated sheets. And so if you have a planned or unplanned hospital visit, you just tear off one of the perforated sheets and you can give it to the nurses, to the physician. As you know, the shift changes every 12 hours, and so you can just kind of keep using it. But it says, you can highlight or write down, the medications that you're on, but it has a chart saying, if I'm on this medication, these are the medications that I should not have. These are the medications that interact with my Parkinson's medications. And then also it really explains how important it is to have your medication on time every time. And so it's a way to empower the caregiver, the person with Parkinson's, to advocate for yourself in the hospital. And this came out of a study that 3 out of 4 people with Parkinson's do not receive medications on time when staying in the hospital, even though timely dosing, as we know, is critical. So I highly encourage everyone to have a hospital safety guide, and it is free to everyone. And finally, let's look at how we're educating and empowering our community. So the Parkinson's Foundation funds community programs that make an impact in local PD communities and help people live better with Parkinson's today. We have funded 787 local grants across the country that are impactful, sustainable, scalable, and measurable. Community grant recipients can include wellness and exercise programs, voice, music, art therapy programs, and educational programs and events. We focus on programs that educate and deliver exercise programs specifically designed for people with PD, and make it available to the caregivers as well. Address the intersection of mental health and PD, and reach and support the care partners of individuals with Parkinson's disease. And I'll say that this grant is open right now, and it closes on January 31st. And then through our virtual webinars, we offer virtual programming that we call PD Health at Home to reach people across the globe. It's an interactive series of virtual events designed for the Parkinson's community. So we have new weekly at-home virtual programs that focus on wellness, exercise, and mental health. So every Monday at 12 Central Time, we have Mindfulness Mondays, which are weekly guided relaxation and mindfulness events. It's been proven as a very powerful technique in symptom management, in addition to fitness. And so we have Mindfulness Mondays, Wellness Wednesdays, where we have experts discuss critical Parkinson's disease topics. And we'll either have on Wednesdays Wellness Wednesday, or we'll have our expert briefing. And with that, we survey the Parkinson's community, and that's how we come up with our topics, and we find experts to cover the topics of what the PD community is wanting to learn about. And then on Fridays, we have Fitness Fridays, which are PD tailored fitness classes led by exercise professionals who are knowledgeable in Parkinson's fitness and what's needed for symptom management. So now I'd like to share some ways that you can get involved and support our mission. You can support the foundation of our work, furthering our local reach and impact. You can volunteer. We have an ambassador program it's 2 hours long, and it versus you in being able to kind of get out in the community and give presentations. You can advocate as well. And then I also want to share, so we also have our moving day walk in the fall every year in the Dallas area. And then I'll also share an event that we have coming up in Plano on March 1st, so really soon. So as a national organization with a local presence and impact, our chapters have a direct impact on the lives of people living with Parkinson's. We provide PD communities with access to local resources and services, such as support from our helpline, health and wellness classes through our grants, and local education programs and events. So, excuse me. All chapters educate their community about PD while raising awareness and leading fundraising events such as Moving Day to help ensure that people with PD and their families and caregivers live a full life. The foundation provides free educational materials for our local network to distribute in their communities, while our helpline is always ready to assist with information and local referrals as well. So thank you, everyone. And I just want to leave you with the Parkinson.org is such a great resource that we have in addition to our helpline. And so I encourage you to, to bookmark these, and you'll have the slides after the presentation as well. And so I'm going to stop sharing and then open it up for questions.
Thank you, Elizabeth. This was really great because, what happens is that there's so much out there. And, a lot of times I've heard, well, we want to go to the website of the Parkinson's Foundation, but where do we look? What do we look for? So this is really great because now we know exactly the 3 or 4 big offerings that you all have. And I'm just going to highlight that once more before I open it up to questions. There is the library, the Parkinson's Foundation Library, which offers a lot of resources that can actually be tailored to your needs. So if you are someone with a particular need, the library is really good with navigating what would be tailored to your specific needs. So that's one. The second piece is the free helpline, which I think is just such an excellent resource with, so many issues that come up and people want to just call someone and ask, where do I go? What do I do next? So that helpline is super useful as well. And then, the hospital safety guide, the newly diagnosed resources that are sort of like bundles and very useful as well. And the last piece, I think, is the research piece. And I think for me, the question would be, how would someone participate if they want to participate in all of the research offerings that you all have, especially the genetic counseling and research piece. With that, I'm going to open it up to everyone else.
Anuba, that was my question about the genetic testing. Are you talking about testing people that already have Parkinson's, or family members, or what are we talking about?
So this is for people who have a diagnosis of Parkinson's disease. And so I'm going to show you the website. Share. I'm going to share on my second screen over here. Okay, so, and I'll put this in the chat as well. And so you can do an in-home in-home test. So an at-home, where can I participate? So you click right here, at home, online, and then it tells you the parameters for it, and you can enroll now, and you don't have to pay anything. And it even has a watch or a how-to video right here. And it's an at-home blood sample collection. And so it used to be a cheek swab, but it was found to be more effective and could test for a wider range of tests with a blood sample. And so they give you kind of like the step-by-step guide. So you enroll, and then you receive the kit, and you do the at-home blood sample collection. It gives you all the instructions. There's also video. And then afterwards, you'll receive, you'll get genetic counseling. You'll have a genetic counseling appointment. And so and results are available at approximately 2 months after your sample is received. So, are you seeing what? Okay.
Elizabeth, can
Yeah.
you clarify? So if somebody's already diagnosed, what is the purpose of the genetic testing? Is it for research to find out the commonality for people to predict it later? I'm just not sure. It's not something to say that, yeah, if you can explain that a little bit more, that'd be great.
Yeah, so the purpose is there hasn't been a whole lot of research on the genetic component of Parkinson's disease. And so with that, it's been known that at least 15% of people with Parkinson's have a genetic component of Parkinson's disease, but it hasn't been studied much more in depth than that. And so through PD generation, we are starting to find out there is slightly more than 15%. And so in addition to that, it's kind of nailing it down to specific genes, biomarkers and genes that are connected to Parkinson's disease. And so with that, the hope is to have more tailored Parkinson's treatment in the future. And so, the hope is, in the future, the gold standard, what we hope will be is that someone gets a diagnosis of Parkinson's disease, and then immediately after, their doctor says, okay, let's get you a full blood test done so that we know if you have a genetic component, because if you do, then we have these tailored treatment options so that you can live your best life and have better outcomes with Parkinson's. So that's what we're working toward. And with it, it also, if someone has a specific Parkinson's gene, it helps also with clinical trials as well, so that we can get to this goal. And then of course, the goal is to find a cure as well. So it just propels research, making life better for people with Parkinson's now and in the future as well.
Thank you.
Mm-hmm.
Okay.
I was going to share, if it's okay, just some of the helpful web pages. Okay. And then if anybody has any more questions, please, please speak up. I'm happy to answer any questions. So this is an easy way to order publications. So we don't have an S on our website, so it's parkinson.org. And if you do /store and you type it in, it brings up this order publications. And it's a way to order resources for free. And so these are some books that you can order: 10 Early Signs, Frequently Asked Questions, that's a really popular one, Living Your Best Life, Fitness Counts, and then there's the guides that I discussed, the Newly Diagnosed Guide, the Hospital Safety Guide, and then this one's new, the Care Partner Guide, and I'm not familiar with this one. This is, I think, was put on here maybe yesterday or the day before. So this is very exciting to see that there's now a Care Partner Guide. And then we also have resources in Spanish as well. And then, so all you do is just put your shipping information, and then we just ask a few questions just so we can kind of tailor your experience. We do have quite a bit of resources for veterans. And so if you are a veteran, we ask that you share that with us, because if you're, we do have a partnership with the VA. Okay, so in addition, this is our homepage right here. And let's see. So you can, just kind of navigate understanding Parkinson's, living with Parkinson's, resources, and support, advancing research, and then ways to get involved. And our helpline, if you just type in parkinson.org/helpline, it'll pull up the page with the number to call. You can also email them, but you do get an actual person on the phone. And our helpline specialists are specialty trained in Parkinson's. One of our specialists, she ran a support group for 15 years, just very knowledgeable. And let's see. And this is what I wanted to share of an event that we have coming up in your area. And it's Learn More, Live Better Parkinson's Symposium. And this is going to be on Saturday, March 1st. And we'll open the doors at 9 a.m. and we'll have a resource vendor fair. So local, support groups, UT Southwestern will have a table there with total care program information. And we're hoping to get Rocksteady Boxing there. DAPS will be there. So just local, all local resources so that everyone who attends is equipped with things that are all right there in their community as far as resources available to them. And so it'll be at My Possibilities, which is in Plano, and it's right off of the 121, it's right off of 121. It's a free event. We ask that you do register so that we can have a proper head count.
Right off of the bush.
And then we're going to have Dr. Vargasy there, and from UT Southwestern, movement disorder specialist. And we're also going to have Dr. Bradley McDaniel speak about mental health, and have Dr. Julie Abert speak from an occupational therapist perspective on doing not giving up on your hobbies. Kind of, if you're having a hard time doing some of your hobbies that you always enjoyed, she's going to explain kind of ways to adapt different ideas and troubleshooting so that you can do old things in a new way, is kind of the best way to put it. So I'll share all that in the chat.
I actually did share in the chat,
thank you.
Elizabeth. I put in the links to the library, the helpline, the hospital safety guide, and PD Health at Home, which are all of the virtual classes that the Parkinson's Foundation offers. And then I also put in the flyer for the March 1st symposium that's coming up that you all may want to register and participate in. We will be there, as Elizabeth mentioned, one of our UT Southwestern providers, movement disorders clinic providers, is going to be speaking at this event. So it will be a good opportunity for you to connect with your providers as well if you do attend. Okay, any more questions or just things that you may want to clarify? Ask about the Parkinson's Foundation. There's such a huge presence online, and they always pull up whenever you type anything about Parkinson's disease. So if there's more about how you may navigate the website.
I have a technical question about all of these things that are listed in the chat that you've said. Can we access those later? Or is this to do now or never?
Right. I will, right after this event, I will email you all with these links as well so that you have them with you. And anytime you have questions about our events that you may not have asked at the event, please do write to me or Janice, or you can write at OBI Total Care Program at utsouthwestern.edu, and we are very prompt with answering any questions. And if there's any need, we can always also kind of forward it to Elizabeth to answer for us if we don't have the answer ourselves. So, we really encourage and invite your participation and your engagement, whichever way you may prefer to. Okay, Carmen has been raising her hand. Sorry, I didn't see that on my screen.
I think
Hi.
my question, hi there. I just have a quick question. I don't know if this is where with regard to taking the medication every 6 hours and you have to wait an hour before you eat or take it an hour after you eat, is it like terrible if he waits? I understand the situation with regard to eating. However, can you take it half an hour earlier or half an hour later? Is it going to be like 6.5 hours or 5 hours? What say you about that?
Yeah, and that's something that I recommend calling the helpline.
The helpline, okay.
Yeah, they're way more knowledgeable about that than
Right.
And I just did an in-person hosted an in-person nutrition program in San Antonio. So I forgot to say I'm based out of New Braunfels.
Oh, okay.
And I learned something that I had never heard before, but for many people, whenever with Parkinson's who get their carbidopa levodopa, however, whichever form that's in, the bottle will still say take with food, because that is just a standard for pharmacists. They have to put it on there, and I had never.
But that's not, we don't have, I mean,
Yep.
we're not supposed to do that, correct?
Correct. That is correct.
Yeah.
And so I that was very enlightening to me. I had not heard anybody say that before. And a specialist neurologist who was our expert speaker, and so she was able to answer that question. She shared that pharmacists have to put that on there because it's just policy, even though it's not necessarily good advice. And so
Right.
yes, and so always go back to your neurologist, call the clinic, verify any questions that you have, and then know that you can also call our helpline because they're
Okay. Thank you.
Mm-hmm.
It's my understanding that protein is the culprit with carbidopa, levodopa, not so much the other things that you just don't want to have a big heavy protein meal 30 minutes before, 30 minutes after.
Yes, it's a part of the intestines where it's absorbed. If protein is taken at the same time, it reduces the absorption.
Yeah.
Yeah.
Hi, this is Dan Novak. Can you hear me?
Hi, Dan.
Yes.
Hi, I'm not an MD, but I have been doing this a long, long time. And a couple of comments on the protein. One is anything's better than nothing. So if you got a meeting to go to or something like that, you go ahead and take it in advance. Don't wait till your protein or your time or whatever. Second is not everybody has the protein resistance or conflict. So it's not a guarantee. You may say this has never been a problem for me, and there are people that say that. And then third is these extended release medications. I mean, if I take one at 11 o'clock, like I'm getting ready to here in Dallas Central Time, how does it work? How do I do lunch ever? Right? If I have to wait 4 hours before I can eat any protein, it's time for my medications again. So I think there's obviously best practice is try to not have your let it conflict with your protein. But, secondly is take it if you got to take it. A couple comments on the PE generation. I did the genetic test absolutely first time I could because I wanted to know what to tell my children about their possibilities and of getting Parkinson's through a genetic transfer. And so the only way for me to know that is for me to get the genetic testing done. So I did it years ago with 23andMe, and I redid it again with PD Gene, which is free, by the way. And so there's no reason not to do the PD generation test. So that way I could go to my kids and say, at this point, I'm not showing positive for any of the genetic markers. However, that really doesn't change much because the odds of you getting Parkinson's are very low to begin with. Secondly, the odds of you getting it through genetic transfer are very low. And then thirdly, I just got tested. And as of today, the 7 genes that we're testing for and we're tracking, I'm not a carrier of any of those. So your odds are even reduced again. So that gave three shots, 3 home runs to my kids to understand that they're not likely to get it from me. And then as Elizabeth mentioned, it's great for the research. For us to get to personalized medicine, we need to know what your genetic structure is, your genetic profile, meaning all of us that have Parkinson's, so that we can then start testing. Right now, we test 100,000 people, and we don't know what their genetic markers are, and we're just shooting in the wind, trying to find somebody that shows something positive we can learn from. So we need to narrow it down. Wouldn't it be more useful to be testing 500 people that had a certain genetic marker to see what causes Parkinson's to them, and then we can learn from that and go forward with that. So the PD generation, the other main advantage I sell when I invite people to do it is the fact that you will get a phone call from a genetic counselor, and you can have your whole family in the room with you, and you can all sit and listen and learn from a genetic counselor, which is way better than sit here listening to somebody guess like me.
Thank you so much, Dan. Always good to have you and have your perspective on these conversations. And I think that's a great part of what we do here at Total Care also is that our patients are the experts, and they can tell us more than anyone else about all of this. Thank you for that, Dan. With that, I do still want to say, go to the helpline, talk to your provider for, all kinds of medicine and treatment related questions. Yeah.
Yes.
Go ahead, Elizabeth.
Thank you, Dan, for sharing. I'll share. Dan's been such a huge ally and advocate for the Parkinson Foundation. We're so incredibly grateful to Dan, and he was our South Central president for many years, and so we're incredibly grateful. And Anuba sits on our current board as well, and so thank you for that. Does anybody have any other questions?
I don't have a question. I just want to say thank you for doing this. I work in an assisted living and memory care community, and I work with families when they bring their loved ones in. We have somebody here that has CBD, and so it was, and she was misdiagnosed with Parkinson's for years. But the more I know as a professional in this industry, I'm marketing and community relations. I'm not a doctor. I'm not part of our clinical team, but the more resources from each of you as experts, as well as folks that are at home and that are living with this on a daily basis, that I can do better in my role and helping families when they're looking for help, and to help provide the proper training for our caregivers that are caring for people in the community. So I just thank all of you for every, bit of sharing and doing this together.
Absolutely. And thank you so much for joining to learn.
Thank you, Lynn. Okay, so, we're only 5 minutes away from ending this program. So I am again going to put the feedback form in the chat, and I will also send it to you all in email. But, if you can, it's a very quick form. If you can fill it out, before you end this call, that'll be lovely. I also want to send you all another form that you can, do at your leisure. I will send it over email again, but we want to learn more about you so we can tailor the Total Care program to your needs. So when you fill this form out, we'll get to know more about you and be able to tailor to your needs for this program. That's on there. So there's a bunch of stuff on the chat, but I will put all of that in the email as well. Finally, I really want to thank our generous donors who make the Total Care program possible, including the Heggies family. So with that, thank you so much, Elizabeth. this was really a great conversation, and we will have this video going forward on our Total Care Program webpage for everyone to look at. Thank you.
Thank you. It's such a pleasure to be here, and thank you so much for having me.
Thank you.
Thank you.
Bye, everyone. I'll send an email out as well.
All right. Bye.
Stay warm, everyone.
Bye.